Hi, everybody. Today we're going to have Dr. Gary Alexander joining us to talk about trauma and addiction.
Hi, everybody. Thanks for the intro. I'm Dr. Gary Alexander, and have a lot of interest in trauma and addiction, especially in regard to the area of clinical treatment and really how the symptoms manifest in the daily life of an individual, too, which I know we see a lot in clinical work. And one of the difficult things about trauma and addiction is that when someone comes in for treatment, they don't always know that their daily life is still impacted by past experiences. And I think one of the best ways that I've had this explained to me was from a man named John Hartung, who taught the EMDR training that I did, eye movement desensitization and reprocessing, a specific trauma treatment. And he talked about how the perspective for a lot of people is that the past is the past. And that's not the case with trauma. A lot of times the past is the present. And we see that showing up in traumatic memories that lead to the desire to use in a moment, or the desire to think in a moment. We see that some in research quite a bit too, with what we know about trauma cueing or trauma triggering for the use of a substance. So you can have a person who is struggling with some alcohol use, or maybe has an alcohol use disorder, and some of the predominant triggers may be past memories, or stress from past memories, stress from nightmares, flashbacks, or being overly hypervigilant throughout the day. So is that something that you see with some of the clients that you're working with as well?
Yes. And so let's explain trauma a little bit so people kind of understand, because most people think that, most people think that a traumatic event is usually just PTSD and only soldiers kind of have it. But trauma can be experienced by anybody, as long as you've had at least one experience that was very traumatic to you and it's flooding your body and your system. And so with trauma, it affects your brain, right, Tom?
Absolutely.
What areas of the brain do you think are affected the most when it comes to trauma?
So what we know from functional MRI scans of persons with PTSD, but maybe not the official diagnosis yet, but we know that an extensive amount of trauma has taken place. We know that there is an enlargement of the amygdala, which is responsible for essentially this emotional processing that takes place. The amygdala is basically this kind of raw, I guess the best way to put it would be sympathetic nervous system response, where this fight, flight, or fear response really originates. Mm-hmm. And as that is enlarging, we also have the hippocampus, which is something that is tends to be smaller for persons who have PTSD or extensive amounts of trauma in their past. And the hippocampus is something that will regulate essentially this narrative memory of an event. So an amygdala, when you look at that for response to a traumatic event, that's going to be your raw emotion, and then hippocampus, more of a narrative, like you could describe that memory as if it's something that happened, but it doesn't feel like it's happening again while you're talking about it.
Yeah. And you mentioned the limbic system, right? And so so people kind of understand that a little more, that's the structures of your brain that deal with emotions and memory. So when we have trauma or you experience trauma, what you have to realize is that we have these things firing off in our head, our synapses. And when they do that, they're making connections between different neurons. So with trauma, now you're either going to grow or you're going to break certain responses and certain connections inside the brain. And that's why people are said to get stuck in a trauma event, and they'll have those triggering memories. And trauma also affects the rest of the body. So they're going to start feeling their stress response system releasing, and that's when they'll have different hyperarousal states. They'll have trouble sleeping, you know, they might have stomach pains and other kind of body manifestations because their body's being flooded with all the feelings and the memories and the emotions. So they may have shame or dread or fear and anxiety kind of coming together based off of whatever their trauma experience was. And a lot of times when it comes to addiction, it's because they're trying to block it or numb it, right? You know, they're yearning
Right.
some kind of relief or fulfillment from whatever sense of overwhelming emptiness and experience that may be coming back up. Is that something you've seen in your work?
Yeah, absolutely. Both in work and in research and studying as well. With you know, there's this kind of theoretical model that we see play out in trauma and addiction, where it's the self-medication model, or self-medicating approach, and that does take place often. And kind of circling back to the beginning, with what we were talking about, in regard to the way that a client or a person may not even know that, or have made those connections, because I think we're taught a lot in society to let the past be the past, and just kind of leave that stuff alone, and to quote unquote just get up and move on from things. But we can't get up on and move on from things that have that our body won't let us and our mind won't let us move on from as well. So yeah, I see that in clinical work as that self medication to address whatever symptoms that may be present. And in my experience, I've noticed that it looks different for kids than it does for adults too. Have you seen that as well?
Yes, a lot. And just so we kind of clarify some things, if you ever see anything that says dual diagnosis or co-occurring, that means you're experiencing the trauma and the addiction at the same time. So they like to use big words that are kind of confusing just to say that you have two things happening together.
Right. Absolutely. And yeah, that's an important clarification as well. And what we found with substance use and addiction and co-occurring disorders like PTSD or depression and anxiety over the years, is that it's more common than not to have a co-occurring disorder as opposed to as just one substance use disorder or mental health related diagnosis, often coming in pairs. And I think that's where some of the clarification can occur, like you're saying, for both adults and kids who may be struggling.
And kind of tapping into the kids topic, the reason why it does look a little different and it changes as they grow is because we have to remember it's attacking the hippocampus, or the hypothalamic pituitary adrenal gland. So all that means is there's stuff inside of our brain that's changing, and it's releasing different chemicals. So your neurotransmitters are they're shaken up. So they're called dysregulated. That just means that they don't know what they're doing and they got to calm down a little bit. And then that triggers our amygdala, like Tom mentioned earlier, because now we're having that heightened electrical response system, and we don't know how to handle it. So a lot of my clients, I tell them, is this part of your brain is your thinking center, your command center, and that guy turns off. And now this guy back here, that's our primal brain, takes over and says, I need to protect myself. And that's where our fight, flight, and freeze symptoms, reactions come from, because now they're trying to figure out, how do I handle these emotions? How do I handle these memories? And what is my reaction and decisions going to be? And a lot of times what I've seen, especially with my soldiers, is the agitation, the hypersensitivity to either noises or sounds or movements, people, light, because they don't know how to kind of turn this guy back on, shut this guy off, and realize they're not in danger. Nobody's going to hurt them anymore. They don't have to protect themselves. So they might start showing signs of depression, social withdrawing, and insomnia. Insomnia is a big one because the memories keep coming back and they don't want to relive and recount what's going on in there. Is that something that you guys have worked on and seen in your work when it comes to addiction that they're using the substances to just, one, put me to sleep, two, turn off
Yep.
these memories, and three, I don't want to think and feel anymore.
Yeah, 100%. That definitely is a huge factor of really, the best way to look at it is just creating some kind of temporary distance emotionally and physiologically between the memory of the experience and the present moment. That substance or that behavior, whatever it may be, creates that temporary distance. And in the moment, it may work, and that's where it is. It becomes reinforcing over time. To we get into some of the behaviorally reinforcing, and it it can certainly.
Oh, we're losing you, Mister.
I think to know there is that there's good news with all of this, we talked about effects to the brain, changes to the brain, and somebody hearing this might think, oh my goodness, I've been through all this stuff, now my brain is just it's out of my control. I can't do anything about my brain. I'm going to respond the way I respond now because of what's happened to me. But with research into things like mindfulness, and the way that can actually change the structure of the brain, even amygdala, hypothalamus, the limbic system of the brain, and it can kind of create this healing process for it. It's pretty amazing to think about. But therapy, counseling, working through the traumatic events, combined with some other forms and approaches, can create really a different brain structure, which is fascinating too. And but ultimately, I say that to say a lot of people come in with trauma and addiction, and they feel pretty hopeless about it. And I think that's one of the areas where, if I had anything to say to people with trauma and addiction, is that there's a lot of hope there for recovery as well. And we see it a lot. I'm sure that's something that you see quite a bit as well, with hopelessness and need to move towards that recovery process.
Yeah, like you mentioned, the brain is such an amazing system that it heals itself. It regrows. Even though we've had the trauma, we've had the things break and shift. When you start moving towards positive interactions and therapies and stuff like that, it will start to rebuild those dysregulated kind of connections. So with the mindfulness aspect, if you notice with the fight response, a lot of times people are going to have that flexed jaw, their muscles are going to be tight, they're going to have that clenched fist, feeling the knotted stomachs, and the tensions in their legs. So if you start identifying and being mindful that your body is reacting to in those ways, you can start saying, oh man, I'm getting triggered right now, what's triggering me, and why am I going to a substance to help calm it down, when you can identify what's causing these feelings. With the flight response, typically this is a freezing thing, right? But it can look like restless legs. It can look like anxiety, just restlessness in general, or even just excessive exercise because you're trying to freeze up those thoughts and memories. And then that's with flight, excuse me. With freeze, that's more the stiffness, holding your breath, because I've seen people, they hold their breath because they're hold it really tight. They're putting their life on hold, procrastination, sense of dread. So it's just when you become mindful of how your body's reacting, what you're doing when you're being triggered, it's going to help a lot in identifying your trauma responses.
Yeah, absolutely. And one of the best ways to do that, and you and I approach things very similarly. So one of the best things to do for when we kind of talk about trauma and the body, right? Because it kind of sound like foreign concepts. So what do you mean mind and body, my traumatic experiences affect my body. But one of the things that is really easy to do is kind of go through like what we call a body scan, right? And we do that just in your own mind, taking a couple minutes to just sit and relax and kind of scan from head to toe within your own body, and notice, just kind of gently notice places that are tense or tight, or maybe even painful as well. And I think sometimes we're surprised to know that when we sit still for a little bit, we can notice areas of our body that are affected. And to tie that into the traumatic experiences, thinking about and noticing when those memories show up, which parts of our body are affected. Like you mentioned earlier, there are knots in my stomach. And I think that's a common one that comes up often when I'm having a conversation with somebody about their trauma. And I say, well, where do you, while we're talking about that, what do you feel in your body?
Mm-hmm.
It's usually something in the stomach. And then you can ask yourself,
You froze up.
is it cold? Is it hot? All of these things that can really help us to understand the way that trauma is affecting the body. And that gives us an idea of how we're physically affected and what we're trying to distance ourselves from with the use of a substance as well, and to kind of put it all together.
I appreciate you giving some advice and some guidance to the trauma and addiction topic. Before I set you free, Dr. Alexander, is there anything you would like to touch on with EMDR and how that helps with trauma and addiction?
Yeah, absolutely. And EMDR, I'll preface it by saying that there are a number of effective treatments out there for trauma. So if you find someone who is trained in another approach to treating trauma, like prolonged exposure, those are all effective approaches too. And ultimately, the most important thing about healing from trauma and getting the right type of treatment is the professional relationship that you have or we have with the counselor therapist that relationship has shown to extend far past any interventions. But EMDR is effective in and of itself for really addressing the holistic experience of the memory itself. So in a session, we would bring to mind a specific memory and walk through some of the EMDR processing, is what it's called, to essentially stimulate areas of the brain to help basically move that memory along from amygdala to hippocampus. And we talked about that earlier. Amygdala-based memory, very raw, emotional. Hippocampus, it's like we're telling a story about something that happened. There's emotion involved, but it doesn't feel like it's happening right now again. But yeah, EMDR is a very effective approach, along with some of the others. And the key there is getting in and being open and ready to, I guess ready is a difficult word, but willing to step in there and address things with another person.
Yeah. Because with any trauma-focused care, it's about vulnerability.
Absolutely.
Yeah. But thank you so much for talking today and adding your expertise to this topic. We appreciate you very much.
Absolutely. Thank you so much. You take care.
You too. Thank you.